So who better to speak to us on intestinal parasites than Ian Wright? Ian, welcome to the webinar, Vet, and it's over to you.
Well, thank you very much, and thank you everyone for persevering there. I had a few minor technical issues, but we're still in the game, so that's excellent, isn't it? And yeah, thank you as well for the invite to talk about intestinal parasites of cats. I've entitled this not just the usual suspects, because I think when we think about intestinal parasites in cats, if indeed we do at all, I spend a lot of time thinking about them, but we tend to think about tapeworms. So cats go out and they hunt and they show you their deep love for you by bringing you back a little gift, maybe a little mammal or bird for you to share. But the inevitable result of that is that you get tapeworms, and those are very visible segments that you see. There's so much more to the different types of intestinal parasites that cats can get, with potential health implications for cats, but often it equally as important, perhaps more important, is the potential health implications for people. And sometimes that can reach news headlines, can really concern people, but I hope tonight that I can put some of those health risks in perspective and show you some really simple ways that we can all love our cats, enjoy a feline cuddle, but still keep ourselves safe. So, I mean, it has to be said, cats are very good at many things. And one of the things that they're really good at is picking up intestinal parasites. So they get them through the placenta or through the milk. They pick up parasites that way. They pick up lots of parasites through hunting. That is what cats do naturally. And many parasites have attenuated themselves, become very accustomed to taking advantage of that hunting behavior, and cats get infected as a result. They roam, are very, very good at spreading parasites around and accumulating them due to their outdoor activity. And, you know, perhaps inevitably, some of these parasites are going to be zoonotic. Now zoonotic is, you know, we vets, we love big words, but zoonotic just means that they're parasites that potentially we as people can catch as well from our pets. Perhaps one of the sort of, you know, big parasites that cats can get in their intestines, about 10 centimetre long adults, but that we don't often see on the outside, are Toxocara worms. And Toxocara may be a name that you're familiar with through dogs and sort of dog fouling and potential disease at the back of people's eyes. And Toxocara worms are incredibly common. So we have Toxocara canis, which is the Toxocara worm that lives in dogs, but there's also Toxocara cati, which lives in cats. And they're easily the most common worm that you'll find infecting cats and dogs in the UK. And you'll be absolutely right in the sort of conclusion that they can infect people as well. And that's the sort of major health concern with Toxocara, is that people can get infected. And the thing is, there's lots and lots of sort of publicity and talk about catching Toxocara from feces, and predominantly dog feces, but very much cat feces as well, which is why I wanted to talk about it tonight. It is very important to stress that it's unembryonated eggs that are passed in the feces of dogs and cats. So there's no larvae inside. The eggs are passed like in the top right-hand corner that you can see there. And you think, why is that important? Well, it's important because the egg needs to mature like a fine wine and develop its little larvae inside before it becomes infective. And this takes, on average, round about 2 to 7 weeks, which means that they're not immediately infective in the poo that's passed from the dog or cat. So fresh feces, no risk for Toxocara transmission. We'll come to other parasites later where that is very much a risk, but for Toxocara that's not the case. They need to mature. But the vast majority of cats don't get infected through the ingestion of these embryonated eggs. They actually get infected shortly after birth through the milk. So dogs can be infected at birth. The worms reactivate in the bitch and are then passed through the placenta, and puppies are immediately infected. With queens, what happens is that shortly after birth through the milk, cats get infected that way. So kittens, almost all kittens, are infected with Toxocara worms. And if we did nothing, if we didn't sort of worm our kittens, then what would happen is at around 6 months, you get some natural immunity that kicks in, which eliminates a lot of these worms. But some of the worms hide out in the tissues of the cat. And that's where these worms come from that are coming through the milk. But it also means that they can reactivate on and off throughout the cat's life and shed these microscopic eggs in the feces. And in the case of cats, cats tolerate infection with Toxocara remarkably well. So if we think of the huge numbers of cats that are infected, actually very, very few of them that show clinical signs. So we've got almost all kittens infected. And then if you take any group of sort of adult cats, anything from down around 5% of them, maybe 1 in 20, will be shedding eggs at any one time. But if you have an outdoor cat that's hunting, living the dream, you know, maybe as many as 3/4 of those in some stray, even sort of feral populations that are shedding these eggs at any one time. And yet, very few of them show any adverse clinical signs at all. If it does occur, it's because of very, very heavy worm burdens, and they can maybe get diarrhea. Worm burdens can contribute to that. You might get a little bit of failure to thrive, failure to gain weight as kittens, but it does take very large burdens to achieve this. The biggest problem that Toxocara causes is the health risk to people. And this is what's called Toxocarosis or Toxocarosis that you may have heard of. And the sort of tragic thing about Toxocara is it does tend to be young children that are most commonly affected. So most commonly sort of 2 to 4 year olds, but young children as a whole. And this may be because of immunological reasons. So it may be the same as the kittens and the adult cats with some natural immunity kicking in. There's almost certainly lifestyle factors involved as well. So I think most of us can appreciate that 2 to 4 year olds hygiene perhaps isn't as good as most adults. And certainly I've got a 10-year-old, 12-year-old boys, their hygiene perhaps still not always quite up to scratch. So as a result, they may just be more likely to gain infection, where adult people, their hand hygiene perhaps is a little bit better, less likely to be exposed. But there is absolutely no doubt that whatever the reason, young children more likely to get infection, but adults can be infected and are infected as well. Now, there's lots of people who are exposed to infection and don't develop clinical signs, but if you do get Toxocara worms and they migrate through your body, then various clinical problems in people can develop. And easily the most famous of these is what's called ocular larval migrans, and that's where the larvae gets to the back of the eye. It affects the retina and can affect vision. There are also visceral forms, so if you had lots of larvae migrating through your body, then that can lead to abdominal pain, headaches, chronic lung problems, breathing difficulties, and this is called visceral larval migrans. And then there are also what are called covert forms, which just means you can be exposed to infection and feel generally a bit unwell. You know, is that because you've been exposed to infection? Is it for another reason? Sometimes that's not clear. But in these chronically infected people with the sort of covert form, there have been links made to epilepsy, learning difficulties, and asthma. So if you're positive for Toxocara, you're more likely to suffer from these things than people who haven't been exposed. So I think all in all, we can say that being exposed to Toxocara isn't good for you. It's certainly well worth avoiding if we can. So how are people infected? Well, they can be infected through eating sort of raw game or undercooked game, things like pheasant or duck, if it's been caught in the wild. Also, so people culturally have eaten slugs as a remedy for stomach problems and caught Toxocara, probably something that's likely to happen in your day-to-day life. But people are most commonly these embryonated eggs that have been passed in feces and then matured in the environment. The most common way that happens is through eating soil, something called geophagia. And that can happen accidentally or it can happen deliberately. So lots of children love to deliberately eat soil, maybe try it and see what it tastes like. In some cultures around the world, adults eat soil deliberately. But a lot of it is accidental. So children in gardens will be playing with toys, they'll be planting things, enjoying themselves, and will accidentally consume certain amounts of soil. But so will adults. So, we'll perhaps be working on the allotments, we'll have soil on our hands, under our fingernails, and bits of that will get ingested. And in doing so, we may accidentally ingest these microscopic Toxocara eggs. The eggs are also very sticky, so they'll move from sort of cat and dog poo into the soil, but then from the soil, they'll get onto things like dog toys, children's toys, maybe gardening equipment, the pen that you're absent-mindedly sucking while you're considering what to plant in your allotment. These eggs can very easily get moved around. The picture on this slide is a good example of how pica can easily occur. So we have a dog toy here, a Kong belonging to one of my dogs, and my child has rather imaginatively acquired it, stuck a guy on top and turned it into an imperial stronghold, which is great for holding off rebel invaders. You can see very easily how the sticky eggs could get from feces from the garden onto the dog toy and then onto the child's toy and into mouths. So it's very, very easily that these eggs can be moved around. There was been a number of studies now over the years that have showed that these eggs can also embryonate in the coats of dogs. Never look for them in the coats of cats, and cats are fastidious groomers. They tend to groom themselves more than dogs. It's probably not a major route of exposure of people, these eggs in the coat of cats, but it is a possibility. So good hand hygiene around cats is very important, just like it is for dogs. If we take all of these routes, then it's probably round about 1 in 50 people in the UK currently that are exposed to Toxocara, which, you may initially think, well, actually, 1 in 50 people, that's quite a lot. But it's relatively few of those people that will develop disease as a result. And you're probably looking, old HPA sort of government health figures suggested perhaps round about 120 confirmed clinical cases a year in the UK. It's probably in reality much fewer than that that are now being confirmed year on year. We have to bear in mind, though, that lots of cases will go undiagnosed because, people will have, a bit of abdominal pain, chronic headache, and not go to their GP. Even if they do, their GP might not identify and recognise it as toxocarosis, get it diagnosed, and then officially report it. There's probably a lot of cases that are falling between the cracks, not getting officially reported. But even so, it's a relatively uncommon disease. So something we have to take, in perspective, not get too worried, but something that we need to take health precautions against. And the reason I'm sort of dwelling on it so much is because it does get into the news, and people do get very, very worried, and also because a lot of the facts in the news often just aren't correct. And this is a great example from about 9 years ago. This was a press release that got onto the BBC News, Sky News, and was in a lot of the newspapers. This particular one was in the Daily Mail. About a real sort of, horrible event that happened to a toddler. She fell in dog mess in the park and subsequently developed this sort of horrible eye condition, which was reported as toxocarosis, with subsequently these eye difficulties. Well, clearly we can see, looking at this poor child, that something terrible has happened to her eye, but it was fresh feces that she came into contact with. So whatever's happening, it can't have been toxocarosis from those feces. And toxocarosis, most commonly, in the vast majority of cases where the eye is involved, will affect the back of the eye. And we can see here that the skin around the eye has been affected. So there's a lot of fear, a lot of misinformation that comes with these news reports. You're not going to catch toxocarosis from fresh cat or dog feces. Say if you have to sort of clean out litter trays, if you're sort of clearing up after your cat or dog, those fresh feces will not pose a risk. But what doesn't tend to get into the news is the risk that cats pose in terms of Toxocara egg shedding. The focus tends to very much be on dogs, but cats play a very important role in contaminating the environment with Toxocara eggs, and we all have a role to try and reduce exposure to them. So if we take Toxocara cati, if we take any sort of group of cats and group of dogs living in the same area, test both their feces, we'll find that more cats are shedding Toxocara cati at any one time than dogs shedding Toxocara canis. And in a study I did in the northwest of England looking at outdoor cats, about 1 in 4 of them that weren't on routine preventative worm treatment were shedding eggs at any one time, so quite a lot. And there have been studies across Europe that show that in urban areas, cats, and particularly stray cats, play a very, very important role in contaminating the environment with Toxocara eggs. Cats are also uniquely able to bring these eggs into close proximity with people. So you think, well, cats, they tend to have a number 2, either in your litter tray where you can clean it up, or well away from the house. But other people's cats and your own love burying their feces. And if there's a sandpit in a back garden or local council sandpit, then they will love to go and have a poo in there, which brings those eggs, brings that poo into close proximity with people. But then they'll bury it, so you tend not to see it very easily, and that creates the perfect conditions for those eggs to embryonate and then be infectious risk to people then going and cleaning out or playing in those sandpits. The same thing happens in allotments and kitchen gardens. So cats will come along, they'll have a number 2, those eggs will develop in that environment. Then you'll come along, be very proud of the fruit and veg that you've planted, and you might be tempted to try them and take them home, try them without washing them. And then there's an infection risk there. So very, very important to at least rinse fruit and veg before you decide to give them a little nibble. So you have cats bringing the feces into close proximity. You've got potential transmission risks there. So we need to consider worm treating or treating for worms in cats as well as dogs to try and bring Toxocara under control. And minimising the risk of human toxocarosis, so minimising that risk to people, is very much a multi-stranded approach. There's lots that we need to do and lots that we need to consider. So covering of sandpits is a very, very simple thing we can do to stop cats having a poo in them, both our own and other people's cats. Good hand hygiene is very important for children and adults, helps to block the transmission of lots of different parasites, including Toxocara, and we'll come back to that a lot over this talk. Although it's not directly linked to cats, picking up of dog feces, effective anti-dog fouling campaigns, very, very important. And the humane control of stray cats, so promoting good neutering campaigns, getting our cats neutered, making sure that we don't have an excess of stray cats is very, very important to ensure that they're not contaminating the environment as well. The most important thing we can do is to make sure that we effectively treat all of our pets for worms routinely and regularly, and that's both cats and dogs. So, because almost all kittens are infected, it's very, very important to treat those. So we want to treat kittens every 2 weeks, from 3 weeks old until 2 weeks post-weaning. Some medications are licensed for monthly, so that's fine. Monthly treatment is fine up until 2 weeks post-weaning, and then whatever you're using every month up until 6 months of age. So you'll go and take your kitten along to your vets, maybe at sort of 8 weeks, and at that point it's going to be monthly worming every month until 6 months old. After 6 months, it does very much depend on your cat's lifestyle. So any cat could be infected and any cat could be shedding. And we know that 4 times a year treatment, as a minimum, 4 times a year will reduce egg output and help to reduce environmental contamination as a whole. So if you have your cats going outdoors, visiting other gardens, if we are treating that cat at least 4 times a year, it will shed worm eggs less than those that aren't being treated or are only being treated 2 or 3 times a year. 2 or 3 times a year appears to make no difference. So 4 times a year is that minimum recommendation. These eggs, though, in the environment are very, very hardy, very long-lived. They can survive for years once they're in the soil, and they don't tend to wash out unless it's very, very sandy soil. So that 4 times a year won't protect individual households that are at high risk. So if you've got households with young children, immune suppressed individuals, or if you've got hunting cats that are going to have very high burdens of Toxocara, then even worming 4 times a year, you're going to get build-up of eggs in the environment, in your garden, in your immediate surroundings. So for those cats, monthly worming throughout adult life, carry on worming every month, is vital to minimise the risk to people. But in doing that, you're going to almost completely suppress egg suppression by Toxocara, and that is going to, by and large, from your own pets, nullify that immediate risk. So if you're in doubt, if you have children that cuddle your cats regularly, you want them to enjoy that bond, don't want to be worrying about Toxocara, then monthly treatment is the way to go. Now, we couldn't talk about worms in cats without talking about tapeworms. Turn up all the time, very, very common in cats that hunt and in cats that have fleas. And many a neutering day in my clinic that is livened up by a little tapeworm segment crawling out of a cat's bottom, I'm always pleased to see it. You may not feel quite the same way. They are that little bit off-putting. But they fall into 2 groups, broadly speaking. So we have Taenia worms that are cats get infected by hunting or by eating dead prey. But then you also have the flea tapeworm, Dipylidium caninum, which is flea transmitted, that isn't transmitted through hunting. Taenia tapeworms are enormous. They can be meters long, and chunks of them can be shed in one go, but by and large it's individual large segments that are passed, and they're motile. They can move on their own. They'll sort of crawl around the anus, or they'll get off onto fixtures and fittings. But Taenia, relatively slow-moving segments. Dipylidium caninum is a smaller tapeworm. It gets up to just about ½ a metre long, but its segments, about the size of a grain of rice, can really shift. So they'll actively crawl out of the anus. They'll be moving around the bottom, crawling off the cat, and extremely, extremely mobile. Well, as I say, Dipylidium caninum is transmitted through fleas. So what happens is infected cats pass these segments in their feces, and they rupture, and they've got little egg packets inside. And these are eaten by flea larvae. Those flea larvae grow up to be adult fleas, and then those adult fleas have little tapeworm cysts inside them. And cats get infected by grooming those fleas off the coat and eating them. And then the little cysts develop into adult tapeworms in the intestine of the cat. And Dipylidium especially, as tapeworms go, the relatively small tapeworm, extremely well tolerated in cats. You need huge numbers of the tapeworm to cause any degree of weight loss. Very large numbers might potentially cause intestinal obstruction, but you're talking about very, very heavy infections. The vast majority of cats tolerate the tapeworm very well. So you might think, well, in that case, we don't need to worry too much, but a lot of people understandably find the segments themselves crawling out of the bottom just very, very unpleasant, and that's completely understandable. The segments pose no health risk to people, but you don't like to think of them crawling about. Often for that reason, people want to get the infection under control. Sometimes the little segments crawling around the bottom can irritate the anus as well. So it's probably best to eliminate infection if you can. The thing is, though, they can infect people as well. It's not the segments that infect people, although it's not a very nice thought. Little bits of flea, if your cat's infested with fleas, can get under your fingernails when you're cuddling your cat, or also can get onto the saliva if cats have been grooming them, and then when we have a sort of facial snuggle, bits can get into our mouths. And in that way, we can accidentally ingest these cysts ourselves. Now, if we do, you've suddenly got a new friend in a sort of 50 centimetre intestinal tapeworm. People aren't infected very often. If they are, the tapeworms don't tend to do us very much harm at all, but we might see segments passed in our own feces. So if that happens, worth considering whether we have flea tapeworm in the house. The vast majority of the time, though, you're just working to eliminate these segments, and the best way to do that is adequate flea control. If we can control the fleas in the house with using a routine preventative flea product often enough, then we'll prevent exposure, or the vast majority of exposure, to fleas by cats, and then they won't ingest them and they won't get the tapeworm. If they keep being exposed to fleas, they'll keep getting reinfected. In contrast, Taenias are obtained by hunting. So the cysts, the intermediate hosts for these, the cysts are in sort of small furry creatures, birds, and the cats obtain them through hunting these creatures, or by scavenging them after they've died. As a result, again, the tapeworm develops in the intestines, and you have these segments shed. These are bigger tapeworms, so you don't need quite as many to start to get loss of body condition, perhaps some weight loss. But again, they are very well tolerated given how large they are. These big tapeworms pose absolutely no risk to people whatsoever, but they're just not very nice. So if your cat is shedding these segments, unless you can prevent them from hunting, you're going to have to use a preventative treatment of some sort. So We can certainly break the life cycle by keeping cats indoors. Some cats are naturally indoor cats. I think we can all agree that cats that, you know, like to live the dream outside and hunt are difficult to keep in indefinitely. So that's not impractical for all cats. Tapeworms can be transmitted by eating raw diets or either by sort of having exposure to them. So if you are feeding your cat a raw diet, it's better well, either that it's cooked, or if you're going to feed it raw, that it's pre-frozen adequately. So to -18 degrees C for 7 days, and that will prevent transmission that way, say through infected poultry or rabbit that might be in the raw diet. Flea prevention, very, very important to control the flea tapeworm, D. caninum. And at the end of the day, if your cat is shedding segments, then those segments can be kept eliminated by monthly treatment with an adequate tapewormer. And there are a lot of combination products now that have a roundwormer. So, you know, if you're treating for Toxocara and a tapewormer to control roundworm and tapeworm together. So, you know, one tablet or one spot on will often do both types of worm. But worms are not alone in the intestines of cats. There are also microscopic single-celled organisms. So there are bacteria, but as well as bacteria, there are parasitic, what we call protozoa. So these are also single-celled, but they're more complex, more complicated cell structures than bacteria. There are all sorts of different types. But certainly the three that are perhaps consistently the biggest sort of health problem to cats and people are some protozoa called Giardia, Toxoplasma, that some of you may be familiar with. I'll be talking about that a little bit. And one that isn't zoonotic called Tritrichomonas, which is a bit of a mouthful, but another single-celled organism that can cause diarrhea in some cats. The difference between protozoa and worms, apart from their size, is that there isn't a routine preventative treatment that you can just give to stop cats getting protozoa. So if they are being infected regularly, we have to look at lifestyle and ways of trying to keep the parasite eliminated from groups of cats. And certainly in terms of human health risk from these protozoa, good hand hygiene, so lots of hand washing, and thorough washing of food that's intended for raw consumption is vital in control. So if we consider Giardia first, Giardia is another big word coming up, is what's called a flagellate protozoa. It's a very posh word. All it means is that it has these little tentacles that are called flagellae, which they use to move around. So they beat, and that allows this single-celled organism to move around. You can see on the right that it's also got this big sucker that it uses to stick to the intestinal wall, and it will graze on the intestinal wall. It'll absorb sort of food contents, little bits of the mucosal lining, and they'll live in the intestines of cats very, very happily. They have a direct life cycle, so when these funny alien-like looking organisms are ready to be pooed out, they'll form a cyst, which is much hardier in the environment. So that cyst is passed out, and it's immediately infective to other cats, and that's called the fecal-oral route. So, you know, it's passed out in the poo, consumed by other cats, on the life cycle goes. There are lots of different species and subspecies. So Giardia felis in cats tends to be fairly species specific, rarely infects people. So there is a zoonotic risk from cats, but it's low. You know, if you're going to catch this parasite, it tends to be the one, something called Giardia duodenalis, which can infect people and cats and dogs. And we tend to get that from other people when we visit foreign countries, or if there's an outbreak, say in the water supply, or we know people who are infected, people tend to pass the parasite among themselves. We just have to bear in mind that if we're infected, then potentially, if our hand hygiene isn't very good, we can infect our cats. What it tends to do is cause diarrhea in cats. Now, lots and lots of cats are infected with Giardia, and a great many of them will never develop clinical signs. But there are particularly kittens, but also some other cats that perhaps have got other intestinal issues or other parasites, Giardia will go on and cause diarrhea. The reason this is important is if you go to your vet with your cat and your cat has diarrhea, they may want to do diagnostic tests for Giardia, and that almost involves playing with poo, which makes my day. I like a bit of fecal examination, having a look at it. And they might do something called fecal flotation. They may use flotation solutions to float the eggs out of the poo, so they can have a look under the microscope. They may use SNAP or patient-side fecal tests to look for what's called antigens, so bits of the parasite in the feces, microscopic bits, to see if it's present. In terms of sort of minimising zoonotic risk to us, if we have a positive cat, because a lot of people contact SCAT, the organisation I run, or will ring the vets and they'll say, look, my cat's been diagnosed positive, or will have diagnosed it in the practice. They'll have gone online, seen that there's a human health risk. Well, let's say the first thing to say is that health risk is very low from Giardia. And if we are to get it, it's fairly life-threatening, but can cause a range of severity of diarrhea in people. We very, very rarely catch it from cats. To really minimise those risks, though, good hand hygiene is very important. It's also very important for contamination from other people's cats or cats visiting allotments to wash fruit and vegetables intended for raw consumption thoroughly. We do need to bear in mind, though, this risk that if we get infected with human Giardia, perhaps after a great holiday abroad, sort of Africa or the Far East, South America, we come back, we've caught a bit of Giardia, then we are a potential risk to infect cats and dogs. If we infect cats and dogs, they could then go on and infect other people. So we just need to bear that in mind if we're confirmed with Giardia and we've got it from elsewhere. Tritrichomonas tends to cause large bowel diarrhea. So this is another flagellate protozoa, very closely related to Giardia. But unlike Giardia, it's completely non-zoonotic, so it really can't infect people. There are Tritrichomonads that can infect people, but they don't involve cats in any way. What Tritrichomonas is good at doing is causing diarrhea in cats, large bowel diarrhea, so with lots of blood and mucus. Actually a very difficult parasite to treat. You need a drug called ranitidazole to treat it. It can have unpleasant side effects. So often it can be self-limiting. It's worth seeing if Tritrichomonas will sort of burn itself out in patients. But it is treatable if it needs to be. If your vet suspects it, then they'll diagnose it with fecal samples that are collected over a period of time, and they'll test those feces again for bits of the parasite by a test called PCR. So it actually looks for the DNA of the parasite and amplifies that up to see if it's present in the feces and could be causing your cat's diarrhea. If you have a group of cats, or if you have a sort of breeding establishment or a cattery where infection goes in, you do have to consider how to block transmission and stop these parasites being passed from cat to cat. So the way to do that, it's very important to wash the sort of perineum around the anus, particularly of infected cats, infective life stages will stick to the fur where there's been fecal contamination. So use shampoo, sort of cat shampoo, thoroughly shampoo that area, wash those cysts off. If you've got a lot of infection, it's helpful to move pets to a new sort of area. So either to move them to new rooms if there are areas with a lot of litter trays, or in cadderies or breeding establishment, move them to new sort of kennel areas. So the old areas can be thoroughly disinfected to kill the parasite. And it is also useful if you've got a lot of cats in one area to screen animals, so to test animals that aren't showing clinical signs, to identify those that are shedding cysts or infective life stages, so then potentially they can be treated to stop them shedding and causing further problems. Perhaps competing with Toxocara, I'd be interested to hear afterwards, but perhaps the most famous of the parasites that I'm going to talk about this evening, though, is Toxoplasma gondii. And this is because of its link to pregnancy and causing problems in human pregnancy. And certainly I think that there's a well-known among the public link to cats, but not all members of the public quite understand what that link is or what sort of risk cats pose. I think perhaps what a lot of people don't appreciate as well is that it is an intestinal protozoa. So that's where this parasite spends most of its life, certainly in cats, is in the intestines of cats. And what happens is periodically infective cats, not very often, has to be said, but occasionally will shed infective cysts in the feces called oocysts. And then potentially those oocysts can infect other animals. So a little bit like tapeworm, Toxoplasma is a parasite that has what's called a definitive host. So that's the cat. Only the cat can shed the oocysts, the infective stage in the feces, but then a huge range of intermediate hosts. So birds, rodents, sheep and people can have cysts in their body, but don't shed them in their feces. An infection of people and cats occurs either across the placenta at birth or through ingestion of these oocysts passed in cat feces, or through the ingestion of tissue cysts from intermediate hosts. So people might be infected through eating lamb, for instance, if it's not been cooked thoroughly, or through oocysts in the feces of cats. So I'm just going to demonstrate this in this little life cycle. This life cycle is from the CDC, which is the American Center for Disease Control, but it has some great information and often some wonderful life cycles. So this shows that what we want to sort of concentrate to start off on, I know this, you look at this and you think, crikey, it's a complicated life cycle. But if we concentrate on the red arrows on the right, this is how Toxoplasma would work in the wild. And if this was all that happened, we wouldn't need to worry too much. So you have cats shedding on and off these fecal oocysts. And those fecal oocysts will be ingested by small birds, small rodents that are foraging in the environment, accidentally take them in, and they will have tissue cysts develop in their body. They're then in turn eaten by cats, and the circle of life is complete. Perhaps the odd fecal oocyst will be shed again. By and large, the cat will be absolutely fine. Might develop some diarrhea in heavy infections, particularly kittens, might develop neurological signs. But the vast majority of cats infected with Toxoplasma do absolutely fine. The problem is if other intermediate hosts get infected. So sheep and pigs can get infected, and this can lead to abortion and economic loss for farmers, but also people. And people can become ill through infection, but also if infected during pregnancy, there can be problems as a result. high human health profile. If your cat has particularly neurological signs, particularly not initially diarrhea, because there are lots and lots of other causes for that that are more common. But if you have kittens or an adult cat that develops nerve problems, perhaps loss of balance, paralysis, difficulties moving, then one of the things that your vet will consider is toxoplasma. And you can look for these oocysts in the feces, a bit like Giardia, but because they're so rarely shed, that's not really such a useful diagnostic tool. So what your vet will tend to do is do blood testing and look for antibodies to the parasite. Now, that doesn't mean it's definitely causing the problem, but if your cat's got neurological signs and is seropositive, and particularly if it's got rising levels of antibodies against toxoplasma, then that is suspicious of a clinical infection. What is interesting, though, is that a lot of people ask us whether, if they're pregnant, they should be blood testing their cats to see if they're positive. Well, there's absolutely no relationship that's been found between being positive for toxoplasma in terms of having antibodies and the risk of you shedding oocysts if you're a cat. So there's actually no increased risk to people if your cat's positive for Toxocara on a blood test, and therefore toxoplasma, sorry. And so therefore, unless they're showing clinical signs, there is absolutely nothing to be gained by blood testing them for this parasite. People do get infected though, and what happens is that you either get what's called acquired or congenital toxoplasmosis. So I'll just sort of talk you through both of those things. Acquired toxoplasmosis is when you get infected and you're not pregnant. So you might get infected through shedding of oocysts from cats, but most commonly through the consumption of undercooked meat, especially lamb. And if we look at sort of prevalence, if we look at the number of infected people across Europe, that has decreased dramatically over the last few decades. And that's largely because people have just started cooking their food more. And, you know, sort of raw meat as a delicacy has fallen out of favour somewhat in Europe. Also, good hand hygiene, hygiene standards are improving all the time, and biosecurity on farms is increasing as well. So sort of overall risk of toxoplasmosis has gone down compared with, say, 30, 40 years ago. It is still out there though, and people do get infected in the UK regularly. If you do get infected, the vast majority of the time it'll be subclinical, so you won't show any clinical signs, or you might get some flu-like signs. You'll get better. You'll never know that you had toxoplasma. It can, though, be very serious, very severe in the immune suppressed. So it is important, and I mean, your doctor would talk you through this, but in HIV positive people, people who are on immune suppressants for transplant therapy or on immune suppressive doses of steroids or chemotherapy, then toxoplasma becomes a much more serious risk, and you know, precautions need to be very tight to try and ensure that you don't get infected. There are virulent South American strains that cause more severe illness, but generally they're not seen so much in Europe or the UK. So for most of us, a bit of mild flu-like symptoms is about the worst that we can expect to have. It did hit the news recently because of the potential effects on people's behaviour. So if you get infected with these cysts, you're infected for life, and you know, they might hang out in your muscles, they might hang out in your organs, but sometimes they'll hang out in your brain. And we know, for instance, that infected rats are more likely to seek out cat urine and indulge in risky behaviour. And this is an advantage to the parasite because we know then they'd be more likely to get eaten. So, you know, those effects are very real and they're there. So people started to look for links in people. And there is absolutely no doubt that there are risk factors. So if you're positive for Toxocara, there is an increased risk of, say, people indulging in risky behavior, of various forms of psychosis, of suicidal tendencies. We have to bear in mind that these risks of developing these problems are already very low. So an increase in that risk still means if you're infected with Toxoplasma, the odds of you developing these problems are still low. And that perhaps isn't reflected in all of the reporting. So there was lots of reporting that, oh, you know, if you own a cat, if you're positive for Toxoplasma, you're more likely to be suicidal, you're more likely to indulge in risky behavior. Well, like I say, although this is true, the risks are still low, and most Toxoplasma infection isn't linked directly back to cats. So cats have really had a bit of an unfair press in all of this. The most famous form of Toxoplasma, though, is if you get infected during pregnancy, and this is a risk to be taken seriously. So if you're infected from about 3 months before you get pregnant, right through until when you give birth, there is a risk of there being complications with pregnancy or illness developing in children afterwards. Now, this risk is still low, and the infection has to happen during that time period. If you're already infected and you get pregnant, there is no problem. Even if you do get infected during pregnancy, it can still be subclinical. And, you know, it's round about 6% of people who are exposed and get infection for Toxoplasma, say during those 3 months through to the sort of first trimester of pregnancy. It's about 6% that will have complications as a result. The odds of established infection go up considerably, right up as pregnancy progresses if you get infected, but the ramifications of infection go down, become less serious potentially the later pregnancy goes on. Unfortunately, you know, there can be miscarriages, birth defects, difficulties as a result of infection during that time. Like I say, there are also subclinical infections that are then passed on to children after birth. Some of those can go on to develop eye lesions afterwards, difficulties as a result, but all of these cases are relatively uncommon, but common enough that precautions should be taken so that you don't get infected if you can avoid it during pregnancy. So what can we do? Well, certainly, again, excellent hand hygiene. Coming back to the same thing, it's very, very important. Good hand washing, washing of fruit and vegetables intended for raw consumption, thorough cooking of meat, extremely important for all sorts of reasons if you're pregnant, but certainly for the transmission of Toxoplasma. And you may well be antibody tested to see whether you're negative, to see what your status is, negative or positive, going into pregnancy, so that risk can be managed. What we get asked about all the time is whether there's whether you should move your cats out when you're pregnant, whether other people should be changing litter trays. Well, there's certainly no need to move your cat out. Individual cat poses very, very low risk to an individual person, given the chances of them shedding are very low. The sensible precautions that you can take with good hand hygiene to minimise any risk. I mean, you certainly, if you're going to change litter trays yourself, you should wear gloves. Ideally, if you can get someone else to do it for you, fantastic. Carry on afterwards. But, you know, overall, I can't stress enough that the risks are low. And you can even get yourself a cuddly tachyzoite, toxoplasmosis, to keep you company if you want as well. So in terms of just sort of summarising for overall control of intestinal parasites, it's very important to keep things in perspective. So I've talked about all sorts of parasites that can infect people, can make people ill, I mean, with potentially serious ramifications, but these things are uncommon and the risk is very, very manageable. So with good hand hygiene, a good food sense, but also where it's appropriate, using monthly worming regimes, monthly worm treatment strategies, and where appropriate, adequate flea control as well. And then we can continue to give our lovely cats and kittens a wonderful cuddle in safety. There's a lot of information that I've thrown at you there. If you're interested, if you have any questions, you'd like more information, please come on to the ESCAP UK and Ireland website. So we're completely independent, we're non-for-profit, lots of information there about effective parasite control in cats for all sorts of parasites, and all sorts of experts who can answer queries, and we do answer queries for free. So you can put in questions into the website and we will do our best to answer them. And of course, I'm available to answer any questions now. So thank you very much.
Ian, that was absolutely fabulous. One of the reasons I love listening to experts like yourself is you make potentially worrying and complicated situations so simple and easy to understand. So thank you for all your input tonight.
My pleasure.
Also, a big thank you to Feline Friends for sponsoring tonight. If it wasn't for them, we couldn't have brought you this valuable information. So thank you to Feline Friends. Ian, I haven't had any questions through. I think everybody has sat riveted listening to your information that has been so clear that you have answered all the questions for them. But
fantastic.
Yeah, it is great. And I think your summary was perfect there of prevention. Wash your hands, parasite control in your pets, and be sensible. I think that's absolutely fabulous.
Yes, and like I say, don't worry too much. People worry about these things, but cats are there to be enjoyed and have a wonderful relationship with. Just have those sensible precautions in place.
Yeah, it's always a pity when the journalists get involved and then they blow everything out of proportion and make things scary when they needn't be.
Yes, very much so. But we're there to rein it all back in, so it's okay. It's all okay.
Folks, don't forget the ESCAP website is there, and it really is there for your use and for answering all your questions. We do have one that has just come through now. Sandy has asked, I breed cats and they have no fleas. Do I still need to worm? Only one of the cats go outside.
Right, okay. So this is something that we are often asked. It's a very good question. So, I mean, in terms of breeding cats, but cats in general, people will say, well, my cat doesn't go out, so therefore, do I need to worm treat them? Well, in terms of tapeworm, if your flea control is adequate and they're not going outside, then you don't really need the tapeworm treatment. But the roundworm infection in all cats tends to be for life, and you'll get this reactivation on and off. So I think even if you've got a low risk cat, like an indoor cat, there's a lot to be said for worm treating them 4 times a year. And pregnancy, though, is a completely different kettle of fish. So these parasites will wait, these roundworms will wait to reactivate once cats are pregnant. And once the queen is producing milk, these larvae will get into the milk. So even if the cat's never been outside, these larvae will emerge, get passed through the milk, and the kittens will get infected. So that's why treatment of the kittens, but also when you treat the kittens each month, I would treat the mum as well, because she will auto-infect and she'll get some worms on board. So those kittens, that kitten-mum relationship, that time is a great time for worms to re-emerge, re-establish, and sort of roundworming at that time is very, very important.
And what also makes it worse, inverted commas, worse, is the fact that it's a really cute, cuddly time. So everybody wants to handle the kittens and kiss them and
Yes,
everything else.
absolutely, yeah.
And so they spread the love around and they spread the parasites around as well.
That's true, yeah. So, yeah, no, so I mean, it is, you know, and I mean, sort of vets will debate and talk about whether you need to sort of worm adult cats and how often. But the one thing that we all agree on, absolutely agree on, is monthly treating of kittens for roundworm is absolutely essential. So that is very important.
Yeah, and you know, the parasite controls that we use in our practices nowadays are really so sophisticated. I mean, I can remember 30 years ago using things like dicestal that used to create massive purging diarrheas in animals for days on end. So then
Yeah.
you could say, okay, maybe not. But nowadays they are so safe and they are so well
They are,
controlled.
yeah. They're
that
very safe, and they're
yeah,
nuclear weapons as well. I mean, they'll just wipe, you know, the worm burden out. But
yeah.
they can't touch these arrested phases that are in the muscles and in the organs, and that's why the cycle goes on. So you do need regular worming, but modern wormers are, you know, very, very safe and
Intestinal.
effective.
Yeah, yeah. Brilliant. Ian, once again, thank you for your time and a huge big thank you for your perseverance to get you on tonight. It was touch and go,
Thank you. Yes.
but we got you there in the end and it was
We
definitely
got
worthwhile.
there in the end.
Definitely
Fantastic.
worthwhile. To Phil, my controller in the background, thanks for all your help as well. To all of you for attending tonight, thank you very much. And we will see you on another webinar in the future. From myself, good night.